Good evening, everyone. This is Meldita, and I'm back here at my YouTube channel, MELDITA'S Info Corner, and my Facebook is johnrigacho@yahoo.ca. Last time, I talked about ventricular tachycardia with pulse, CRTD, and V pacing. So, I will be mentioning more, or maybe just a little bit of these devices, pacemaker and ICD, just for, a little information. It's not perfect, but just to give you some enlightenment. Okay, so permanent pacemaker. So permanent pacemaker, we have two kinds here. We have the single chamber, and we have also the dual chamber. The single chamber pacemaker could either be atrial pacemaker, or it could be ventricular pacemaker. Atrial pacemaker, it is used for sinus node dysfunction, but we still wanted to maintain an AV function. Okay, so here we have here a pacemaker generator with one lead that delivers the electrical stimuli to the tissues. Okay, it gets into the left subclavian vein, to the superior vena cava, to the right atrium. So this lead is sitting now here at the right atrial appendage. There is a grip or hook for proper or for good securement, and also for good contact between the generator and that of the right atrial tissue. Okay, so the right atrial lead is where our right atrial pacemaker. Okay, so as I said, this is used for sinus node dysfunction, but we still wanted a good AV function. And the strip here is we have an AV pace. If we have here an atrially paced rhythm, shortcut A pace rhythm. So if you look at that, there is spike before the P waves. So atrially paced rhythm. Another example of single chamber pacemaker is ventricular pacemaker. Okay, so here we have a generator, one lead coming off from the generator that delivers electrical stimuli to the heart tissue, to the right ventricle. So lead come off, goes or gets into the left subclavian vein, to the superior vena cava, passing the right atrium, and it goes to the right ventricle. The tip of that right ventricular lead is at the apex of the right ventricle. It takes a good grip or bite for good securement, and also for good contact between the generator and the tissue of the right ventricle. Okay, the ventricular pacemaker is usually used for patients with slow AFib or slow flutters. Okay, they don't have good sinus peace and everything. Okay, and they are used, this is the kind of pacemaker they will use, these patients with slow AFib, slow flutters. Okay, and we don't have a good sinus beat. Okay, so the right ventricular lead is here, and the tip, as I said, is at the right ventricular apex. And if you look at the ECG here, we have a ventricularly paced rhythm, or shortcut B pace rhythm. Okay, so another kind of a pacemaker is a dual chamber. Okay, the dual chamber here, and or the so-called atrioventricular pacemaker. So we have two pacemakers in here, one from the right atrium and one from the right ventricle. So here we have the generator. Okay, there are two leads coming from the generator, passes the left subclavian vein to the superior vena cava. So the right atrial lead stops here. The tip is located at the right atrial appendage. Good bite, good grip for good security here, position, for good security position, and good contact, okay, with the generator and the tissues. Okay, and then the right ventricular lead will pass the right atrium going to the right ventricle, the tip of which is located at the right ventricular apex. Okay, a good grip and bite again for good securement, and also for good contact between the pacemaker generator that gives the impulses to the tissues of the right ventricle. So we have two leads in here, one from the right atrial lead, that is your right atrial pacemaker, and one from the right ventricle, that is your right ventricular pacemaker. So normally this dual chamber or atrioventricular pacemaker is used for sick sinus syndrome, pauses, but we have those sinus peace. We want to keep the atrial kick. Okay, so if you look at this ECG strip in here, we have here an atrial spike and ventricular spike, and they are, and they are captured just like the others. There's a good capture just like the others here, good capture. So good spike, good capture follows good contraction. Okay, because we check all the blood pressure and everything, the patient is okay. So we have here an atrioventricularly paced rhythm. Okay, And that is used mainly for sick sinus syndrome or tachybrady syndrome, or those with pauses but still not losing the sinus piece, but we want to keep the HL kick. Okay, I will be talking more about this transvenous pacemaker when we touch on our bradyarrhythmias, because right now, as you see, I talk more about this fast rates like ventricular VTACH and everything, because we are still under the tachyarrhythmias. Soon I'll be touching on bradyarrhythmias, and I will be mentioning about these pacemakers. Okay, so our next video will be about the implantable cardioverter defibrillator.